Welcome to the Health Leader Forge, a joint production of the University of New Hampshire's College of Health and Human Services and the Northern New England Association of Healthcare Executives. I'm your host, Mark Bonica, of the Department of Health Management and Policy here at the University of New Hampshire, and today I'm pleased to share with you a special episode of The Forge. On October 7th, the College of Health and Human Services and the Northern New England Association of Healthcare Executives hosted a special event at the University of New Hampshire, Shaping the Future, Leadership and Public Policy in Healthcare. We had 2 panels and a keynote speaker, and it was a terrific event. You are listening to the first panel, Talent Management for Bench Strength Development. This panel included Samantha O'Neill, the Vice President for Human Resources at the Elliot Health System in Manchester, New Hampshire, Kevin Callahan, the President and CEO of Exeter Health Resources in Exeter, New Hampshire, and Warren West, the CEO of Littleton Regional Healthcare and CEO of the North Country Healthcare in Littleton, New Hampshire. I had the privilege of moderating this panel. The recordings of the other parts of the event are available on our website, healthleaderforge.org. And now, please enjoy Shaping the Future.
Good morning. It's great to have everybody here on our campus. My name is Mike Ferrara, and I serve as Dean of the College of Health and Human Services. And this conference that we're having today in Shaping the Future, Leadership and Public Policy in Healthcare has been a priority for us. One of my strategic priorities, strategic initiatives for the college is to reach out to the community and for us to be partners with everybody. And I would like to thank the Northern New England Association of Healthcare Executives for being a great partner with us. We want to work together with the community, whether it be a local hospital, community service agency, nonprofits, etc. And it's just a wonderful opportunity for the college. I'd also like to thank our students for being here today. Today's part of your journey as you move into becoming professionals as part of your educational program. And please network with everybody here today. It's a great opportunity. Just some quick notes about the College of Health and Human Services. We're made up of 8 different departments. We have Health Management and Policy, which is being featured today, social work, early childhood education, kinesiology, occupational therapy, communication sciences and disorders, rec management and policy, and nursing. And nursing, we offer degrees from bachelor's through DNP or Doctor of Nursing Practice. We have 2 institutes as part of the college. We have the Institute on Disability, and you'll see a lot of folks associated today from the Institute of Health Policy and Practice. I'd like to introduce our leader of this event. This has been a vision of Mark's. And when he brought this idea to us, probably in the spring, I said, this is a great opportunity. Let's pursue it. And Mark has been a leader in reaching out to the community. He has a Health Leaders Forge podcast, and I advocate that you get on there where he's interviewed leaders throughout Greater New England. And it's just a wonderful series, and in particular for our students. It's a way for you to listen to leaders and how they got to where they are now. And I think Mark has interviewed close to 20 folks, 25 folks, 40 folks. So it's an impressive array of information. Mark serves as an assistant professor in our Department of Health Management and Policy. He joined our faculty in 2015 after serving 23 years in the Army Medical Department in a variety of operations and administrative services. So I'm going to turn it over to Mark, and thank you.
Good morning. I'm really pleased to have the opportunity to moderate this first panel, which is called Talent Management for Bench Strength Development. And during this panel, we're going to be talking about succession planning and leadership development. And to do that, we've assembled 3 executives who are really fascinating individuals from 3 different health systems with a diversity of experience and representing the geographic diversity of Northern New England. And so let me briefly introduce our panel. You do have a more extensive biography about each of them in your handout here. But I'd like to tell you why I chose each of these individuals. So starting with Sam O'Neill. Sam is the Vice President of Human Resources for the Elliot Health System. And I've had the opportunity to listen to Sam speak a couple of times. And I asked her to join us this morning because as the Vice President of Human Resources for one of the largest hospitals in the state, she brings an extensive knowledge of challenges facing talent management in healthcare today. And what's really unique about Sam is she also brings talent management experience in high tech and manufacturing fields to the table, which I thought might be interesting for some comparison points today. Kevin Callahan is the president of Exeter Health Resources. I've had the opportunity to interview Kevin for the Health Leader Forge podcast, and it continues to be one of my favorite interviews. I asked Kevin to join us today because he served as the president and CEO of Exeter Health Resources since 1985. And this gives him a unique perspective on shaping talent and the talent structure within his organization, as well as responding to the changes in healthcare environment. And finally, Warren West. Warren is the CEO of Littleton Regional Healthcare and the CEO of North Country Healthcare. As a CEO with an extensive experience with critical access hospitals, Warren brings to the discussion experience with the challenges of critical access hospitals operating in rural communities. Also, in my podcast interview series with several healthcare executives, Warren has come up as a significant career mentor for two other CEOs that I've actually interviewed. So I look forward to asking him about mentorship there. Now, I've prepared some questions for the panelists, which they have had the opportunity to preview. We'll be working with those questions for the first half of the panel, and then we'll open up the floor for questions from you all. There'll be two students moving around with mics, so when that time comes, if you just raise your hand, they'll come to you with the mic. And just for your situational awareness, we're recording the event, and it will be published in audio on the Health Leader Forge podcast sometime in November. So without further ado, let me start the questions, and we're going to start with Sam. And I've been told my questions were clearly written by an academic, so they were giving me a little bit of a hard time before the panel started. So I told them just, answer this question or whatever else you might want in the spirit of like the presidential debates that we've been having. So one of the implications of the title of this panel is that organizations are thinking about succession planning and building a bench of people who could step into higher level roles. So Sam, what's the difference between leadership development and succession planning, and why does an organization need to be thinking about both?
Okay, great. I hope everybody can hear me in the back. So succession planning is looking at your entire organization at all different levels throughout the organization, different departments, different units, to make sure and to look at where you have your strength and where you have weaknesses in area of opportunity. So, for example, we're just rolling this out in our finance department now. So I usually start when I do succession planning, looking at the leadership of the organization within finance and then all the way down. So if we start with the vice president, then we look at the director level, then we look at the manager level. And what we do is we look at who are people that are ready to retire, how many years out, what are people's strengths and weaknesses within that particular department? Where do you have anybody that could step up in 2 years or 3 years? That's the succession planning. So you're looking to see the strengths and weaknesses of not just the organization, but within each department, and then you look at the entire organization as a whole. With leadership development, I've been in HR for over 20 years, and I've been in a leadership role probably 15 of those years. And it doesn't matter how long you've been a leader, but you always grow. You always need to tweak what you're doing, learn new opportunities, look at different things from a different way. So within the Elliot, we have a lot of opportunities for leadership development. We have Elliot University, which is taught by members of senior leadership and directors within the organization. There's on-site classroom training that are taught by members of human resources and various directors. And then online classes. So the difference between the succession planning and leadership development is really developing the leaders. Succession planning is making sure that you have opportunities for not just your leaders, but all employees in the organization for growth for the next level, in making sure that you can really cover all aspects of positions.
So let me pass this to Kevin. At Exeter, do you have a formal process for succession planning and for leader development?
We do. Good morning, everyone. Probably a large part of the time that I spend, or a significant part of the time that I spend, is in fact focused on leader development, succession planning. It's not an insignificant part of my thought process throughout any given year. From a succession planning perspective, we are particularly focused on that, given some of the generational changes that we're expecting to see occur in healthcare delivery. Older people are getting older, and younger people are looking to enter into the workforce. And so we have to anticipate those changing scenarios in which we've got not insignificant retirements occurring. And with that, significant loss of skill sets leaving the organization, experiential skills that have been developed, as well as organizational wisdom that departs with someone who's worked within an organization. Equally as importantly then, so you don't drop the balls that any leader is juggling a lot on a day-to-day basis, how do you incorporate new people into your organization to be able to, if you will, carry the fire forward in terms of the success of an organization and being able to bear the values that an organization has and the culture that an organization has and bear those forward. So we spend a lot of time looking at succession planning. And even just recently, I've made some changes in my executive leadership ranks from the standpoint of physician development and physician leadership, and had also worked with an individual by way of example as a targeted senior executive leader. When he first came into our organization as a physician, I started working with him nearly 7 years ago. And so we think a lot about the long-term prospects for leadership that may emerge in our organization. Related to leadership development, it is an ongoing process. I can't think of an organization that neglects its leaders. I think the difference is largely, from a development standpoint, I think the difference largely is how much effort does an organization spend on leadership development. And obviously from small to large organizations, the resources and commitments to leadership development may vary. But nonetheless, I'd be hard-pressed to think of any organization that has had any modicum of success that is at least not thoughtful about leadership development. And from there, you can expand your base of sophistication in terms of continuing education. The work that we do in terms of leadership identification, we do it annually. We survey leaders every year to try to understand deficits that may exist in their leadership profile. We correspond those surveys with actual performance in the organization, how the organization actually is performing under their leadership. We also correlate those to peer reviews. And ultimately, for all our leaders in the organization, it is about a conversation that we have to have with every leader in an organization to try to understand what their aspirations are and ultimately what they want to achieve in the next year, 2 years, 3 years from a leadership development and capability perspective. So it's a very active process. You can't deliver healthcare. You can't deliver any product in any economy, whether it's an American economy or any other international or any other country across the globe, without effective leadership and without thinking about how your leaders need to evolve in a rapidly evolving world.
Warren, let me ask you, can you give an example of position or positions that you are actively planning in terms of succession and concern about succession planning?
Pretty much at all levels we work on, and there's not one particular position. In small hospitals, so when I talked to Sam, I said, so how many staff do you have? She said, 4,000. I said, well, that's a different league, right? We have about 500 employees, and we sort of, from day one with a new employee, we talk about where you want to be. Focus on today's job, but keep your eyes open for other jobs, because in our hospital, we want people to grow internally. We don't have a dramatic workforce up there, right? So we tend to promote from within. So at all levels, we have mentor relationships. We always talk about to our department heads, how are you going to build your bench? So we talk about constantly how to build your bench, because things transition, the institution gets larger, people do tend to move on, and we can't always recruit from outside. So between the mentoring programs we have in place, leadership development that we do on a quarterly basis, and quite frankly, the day-to-day mentoring that all of our team does, and it's for all of our employees because of the personal touch, because of the size we are, it's just ingrained in our culture to have that mentoring program, to always try to figure out how people can continue to move up. So there's no one particular position.
No, okay. Sam, you mentioned a particular department. You said working in finance. Is this a program that you're expanding across the Elliot? Is it something that's been in place for a while?
It's actually new. So I've been at the Elliot for about 2.5 years, and we didn't really have a formal succession program. So, and that's something, like Kevin had said, you really need to make sure that you have that in place, because people come, people go, people retire, people are looking for additional challenges. So you want to make sure that you can cover that. So we started with nursing a couple years ago. I started with the CNO. We sat, and I do what's called a 9-box succession planning, and it really looks at those that are performing where they should, those that are your key performers that are going to be promoted or could be promoted within a couple of years, those that are ready to be promoted, those that are looking to retire. So what you do is you I hate to use the word categorize, but you categorize an employee, but it's the skill set. And one of the hardest things to do with succession planning is being totally objective. Making sure that you're looking at the skills of the person, not whether you like the person or you don't like the person, or you've had a challenging interaction with them. So we started with nursing, we started with the CNO, and then we worked through the executive nurse leadership team. So I assign everybody homework because you have to look at each individual person. And then what you do is you get into a room and you talk through the talents of that, of each individual one at a time. And it's not just the person that individual reports to, it's the entire team, because you're looking at how do they interact and what is their skill set, not only in their area, but within other areas, cross-function, communication, and so forth. So you look at that, and then you look to see, do you have a lot of overachievers? Do you have 5 or 6 people that are looking to retire in 3 years? Do you have somebody who has a unique skill set that if that person were to leave, that leaves a big hole in the organization? So we started with nursing. I do it within HR all the time. And now we're moving to finance. So it's a long process, but we're starting to move throughout the entire organization.
Did you see that in other industries? Did you learn this process in other industries? And is there a difference between the way we do it in a healthcare facility from your experience either in manufacturing or in high tech?
So I had worked at Velcro prior to coming to Elliot, and we did succession planning there. It's the same process. The skill sets are different, and the knowledge and the expertise is different. So it's really taking that same skill, taking that same succession planning process and moving it to different industries. But it's pretty much the same.
Okay. Kevin, you mentioned a second ago that you identified a physician executive some years ago, and you were going to prepare him to kind of step up into an executive role. So when you identify someone as being part of your succession plan, what's next? What do you actually do with that person?
The physician that I identified as entering into executive leadership subsequently did, and then he ultimately ended up going to California. So I was set back a few years in that process. I'm not sure whether it would be categorized successfully or as a success or not, although my expectation would be, in the instance of this particular physician, he will ascend into a leadership role somewhere else in this country and will have not an insignificant impact on the way healthcare is delivered in that community. So I think that will probably be successful ultimately. And so what I try to think about are how do we create opportunities for leaders in our organization or aspiring leaders in our organization to broaden their experiences, to take risk, to take personal risk in terms of making decisions that have consequence beyond their comfort zone, to progressively expose them to different parts of the organization, whether it's at the senior executive level or at the operational level or at the clinical level. In the case of the physician, obviously well experienced at the clinical level, but not particularly well exposed to the different management processes that can occur in a complex organization. And I think it's true when you think about any complex organization, regardless of what they're involved with, manufacturing, service, or healthcare delivery. Frequently, the people that are in the environment can only see so deep below the surface of the water to understand the complexity of the processes that are occurring. And when they're exposed to those processes in a deeper way, it is eye-opening for them. And so what we try to do for potential leaders in our organization that might ascend to a position a year, 2 years, 5 years into the future is to try to create opportunities for exposure to other parts of the organization. If they are, if there's a view that in fact they would be benefited by advanced training, to have them support them in that advanced training, whether it's at the graduate level, additional graduate work, doctoral work, whatever the case might be. We have also, in some cases, circumstances, also arranged for them to have other industry exposure to see if we can create opportunities for them to observe, to participate, to be mentored in some ways, perhaps by someone else from another industry. In a similar way to what Warren was alluding to, we're not a large organization. We have about 2,000 employees in our organization. We don't have multiple locations around the globe. Let alone around the country, and for a lot of companies, the ability to move leaders or aspiring leaders to ascending levels of responsibility throughout the country or operating divisions or other parts of the globe is a huge development opportunity and an intensive one for a lot of these individuals. So healthcare is a little constrained, at least in terms of smaller organizations such as my own. But we try to create those opportunities where we can.
Warren, as I mentioned in my introduction, one of the reasons I asked you to join us today is because you had been mentioned as an influence by two other executives that I've spent some time with, both Peter Wright, who's now the CEO of Valley Regional Healthcare, and Robert Mock, who's now the CEO of Select Medical, named you as a significant mentor who helped them develop their careers as leaders. Both of these gentlemen were promoted from within the organization you were leading at the time. And I think your relationship with them is a good example of bench strength development. How do you go about identifying talent such as Peter or Rob in your organization? And when you've identified that leadership talent, what do you do different? What do you do differently with them?
With those two individuals, both of them told me they wanted my job. And quite frankly, I love people when they say, I want your job. That gives me a great motivation to help them get my job in some fashion. And both of them were in the institution. Peter actually worked with me at two different institutions. So what do we do different? I try to get them out of their comfort zone. You know, they might know this area of expertise, but I want to get them out into the institution. I want them to get exposed to different people. I want them to get exposed to different projects on an ongoing basis so they can grow their knowledge, quite frankly, so they can grow their resume. And so that's normally how we do it, with a special project that they either volunteer for or I volunteer them for, based on what I think their strengths and weaknesses might be. We meet, probably with these guys, my door's always open because it is a small institution. They can come in and problem solve with me at any point in time, but formally once a week, go over what they're working on, special projects they're encountering. A lot of times, right, you want to let them learn the hard way, but you don't want to let them get in too much trouble. But you really want them to sort of take a leap across that canal and see what's on the other side and not always guide them. But you want to be able to bring them back and sort of ground them through dialogue, through discussion. We talked earlier, Kevin did, about taking risk. You want them to take risk. They're gonna, and I don't mean to pick on these two guys, but you brought them up. Yeah. They're gonna fail at some point in time, and you got to accept that. You just hope it's not that big. And then you ask them about the knowledge. What did you learn, and what will you do differently? And you just sort of build them through that kind of. It's informal because it's such a small institution, but that's what we do. And obviously, very proud of both of those individuals, and they're doing great.
Sam, do you have a formal process at the Elliot or in your prior organizations where you go about identifying potential talent?
We do. Right now it's a work in progress, so it's really informal, moving to a more formal process for through the succession planning process, through some of the new leadership development programs that we're going to now. We have we're just rolling out. We piloted it a couple months ago, an individual development plan for managers and above. So it's really looking at where you feel your strengths and weaknesses are, where you feel you want to grow, and then have coaching sessions with your manager or director or vice president to be able to come up with a plan to get you from where you are to where you want to go. So it's not as formal as we'd like it to be, but it's a work in progress.
Kevin, we talked a little bit about mentorship when I interviewed you. How important is mentorship in your organization? How do you ensure that mentorship is going on at not just at your level, but kind of at all levels?
I think probably all of us in this room at one point in time have been mentored by somebody. I don't mean parented. I mean mentored by someone. And you can't in any way underestimate the importance of that. The mentoring can be intensive. It can be subtle. But nonetheless, somewhere along your pathway, someone has had an impact on you in a positive way. We, as an organization that provides healthcare, which is maybe at its core one of the most quintessentially intensive human endeavors that you can imagine, largely predicated on human relationships between patient and caregiver, and also colleagues that are organized around delivering patient care. And so if you think about the essence of a human relationship and the importance of guidance in that relationship and the importance of trust in that relationship, you begin to understand how mentoring within an organization can help guide people through their development as individuals from a leadership perspective, but also help them through the vagaries of life that occur in any one career, in any one organization. So we have an expectation of leaders that are in place currently. Those are individuals who are currently formally designated as leaders, and I'll get to informal leaders in a moment. These are individuals who it is a clear expectation when they are hired and when we develop them on an ongoing basis that they will in fact mentor those who work with them, and also create opportunities for them to mentor their colleagues. This becomes particularly important if you've got a leadership group that perhaps has had some experience in terms of tenure in an organization. I wouldn't quite say typically they've seen it all, but frequently they have seen it all. And the importance of organizational experience, the organizational wisdom, if you will, to help mentor new talent, new individuals coming into an organization, to help shepherd them through the uncertainties, the conflicts, it can't be underestimated. So an expectation of every single one of our leaders is, in fact, that there is mentoring that is occurring. We have multiple ways in which we are able to evaluate the effectiveness of that mentoring, from our individual reviews with staff, small group meetings, discussions with our leadership. It is a pretty transparent process of leadership within our organization, and mentoring is one of those key elements. It ultimately starts at the top. And what responsibilities do I have as an individual in that organization to mentor, to guide? And my mentorship responsibilities aren't limited by those who directly report to me. I have purposely, consciously over my career tried to reach through multiple levels of the organization to create those quiet moments of conversation with all our staff, create the opportunity for any one of our staff to have conversations with me on a periodic basis or an ongoing basis regarding their career, their experiences in their organization, and their aspirations from a leadership perspective. That's the formal leaders. Every organization has informal leaders, thought leaders, people that are incredibly influential but don't have a title associated with them. They are equally as important in mentoring and creating that environment in which people can succeed. That is a more difficult challenge because those informal leaders are frequently successful because they're not known, certainly by the formal leadership structures. They move in the ether of an organization, but they are in many ways no less influential in creating success at a unit level or throughout an entire organization. And so we always, as an organization, try to acknowledge and recognize the informal leaders, the thought leaders, the people that gently, in so many ways, move an organization forward successfully without a leadership title. They have enormous impact on their colleagues. And how do you encourage them without actually calling them out into the bright light of leadership? How do you encourage them to continue that good work? And we talk a lot about that.
Sam, along the lines of mentorship, does the Elliot have a formal mentorship program? And if not, how does informal mentoring work, and how do you encourage that? And have you seen either of those in prior organizations, and are they is a formal mentorship program effective? So it's a couple of questions for you.
Okay. So we don't really have a formal mentorship program, but it is encouraged and expected by senior leaders to mentor. In my role as VP of HR, I'm coaching and developing leaders and managers and other. Doesn't matter what level of individual you are. It's always an opportunity to improve. I coach managers on how to have a difficult conversation with somebody, or how do you have career opportunities? Where do you want to go within your career? What is the next step? So each leader is really encouraged to mentor. Unfortunately, we don't have a formal program, but I think informal mentoring is just as important, if not more important than formal, because you develop various relationships, as Warren had said. It's you're taking people under your wing and helping them get where they want, even if it's sharing ideas, trying to get from one point of your career to another point, or just you're stuck or you just want to brainstorm with somebody. It's always having that open conversation, and sometimes, in my opinion, not having it formal is actually more successful than having it formal.
Warren, so working in a critical access hospital, which by definition means a smaller organization and a smaller internal talent pool, as well as coupled with typically a rural location, which means a relatively smaller external talent pool in the immediate area. What are the challenges of building a bench of future leaders? And is there a greater urgency to find internal talent and nurture it?
I'd say yes, there definitely is. And this is sort of ingrained in our culture at all levels about how every day we're educating our staff, we're educating each other about where we need to go, how we need to get there, and how we all need to do our jobs. So we do it at all levels, and we have to. As I said, we want to promote from within, so we're always developing people. Everything I do in my day-to-day job is a role model. You want to try to show people how to teach, how to mentor, how to help people grow. And at our organization, it really doesn't matter if you're a housekeeper or you're the CEO, or anywhere in between. We allow people informally to say, I'd really like, and this could be a secretary who says, I want to learn more. And she might get together with our HR director, vice president of HR, and Georgina will say, yeah, I would be happy to mentor you. As the two of them figure out where this individual wants to grow in the organization. But each one of our managers, and each one of our supervisors, and each one of our senior managers all know that the development of the organization, the way our culture is going to evolve, it's imperative upon them to teach, to grow, and to mentor all of our staff at every level, because we are small, and the weakest link is going to have us, fail where we don't want to fail. So we got to make sure everybody is strong, everybody gets brought up to the same level. So it's not formal, it's informal. We have to do it to survive, but it's ingrained in our culture.
Let me follow up
with an expectation.
Oh, sorry. Yep. Let me follow up with a question. You've recently established the North Country Hospitals Affiliation. So you now have an organization with 4 affiliated organizations. Do you see any potential for leader development within the affiliation? Maybe some economies for bench strength development and crossover of leadership?
Absolutely. As we bring the system together, and we're probably 6 months into it now, we've got to find what I'll call system leaders who want to rise above the job they're doing today and take on responsibility within the system. And then we've got to find folks who want to backfill those individuals as we pull the system together from where we are now, 4 distinct hospitals, to 1 system, 4 sites. So we have a lot of work to do there. We need to get into the process of evaluating who the strongest leaders are, who can take on the system role, who can move into those seats. And we are just at the infancy of working through those issues as we pull the system together. But we won't have a choice. I mean, cultures are a very difficult thing to grow, and they evolve every day. And every time, good or bad, you bring someone in from the outside, it's going to help your culture change. So if you can build from within, and these folks already know your culture, hopefully that culture can stay in the direction you want it. So we need to build a common culture among 4 hospitals, which is going to be a trick. And then we need to build the system at the same time. So it'll be interesting.
Well, hopefully we'll get you back to talk about it a year or 2 from now.
So can I add something?
Yeah, absolutely,
so
please.
one thing to keep in mind with succession planning is you're going to have, we have 4,000 employees, Warren has 500. The process for leadership development, you have 1,200, 2,000. The process for leadership development or succession planning is the same regardless of the size of the organization. It's really the number of employees you have to pull from, but the concept of it is exactly the same. And through the process, the other thing that I always try to keep in mind with the HR staff and also with our managers and above is there are some people who are fabulous at what they do, but they might not want to grow within the organization. But how can you keep them challenged in the role that they're in? Do they want to hone in their skills? What can they do to grow within their own position? So succession planning and development is not just about getting from one position to another. It's keeping the employees happy, keeping them satisfied, keeping them challenged in either their current role or growing within the organization. So it's not just the growth piece of it, but it's really making sure that people are happy and have the development that they truly want for themselves in their career.
All right, so here's one of my wonky questions. So this one's for Kevin. In his biography of Steve Jobs, Walter Isaacson quotes Steve Jobs as saying, "I've learned over the years that when you have really good people, you don't have to baby them. By expecting them to do great things, you can get them to do great things. The original Mac team taught me that A-plus players like to work together, and they don't like it if you tolerate B-grade work." And so when I interviewed you, you said something that reminded me of that quote. And you said, "I hire competent people. I provide them support, encourage them to take the risk, encourage them to think differently than me, to push me, cause me to see things differently than the way I currently see things. I tend to place competent people in the roles, align them around our principal vision, our mission, our strategic objectives, and then I let them go." So you said, I want to highlight this, you said you hire competent people, but I suspect that's probably an understatement of what you're trying to do. And so you hear a lot in the talent management literature about A players and B players and C players. So what do you look for when you're trying to hire your team members?
Yeah, I started reflecting on that question, Mark, and as well as the interview response that I gave you. And so I started to write down some thoughts about, well, what do I look for when I hire someone? I actually just hired an executive just a few months ago and started to reflect on that process. What was I looking for? And immediately, and I started writing them down top of mind, and typically what comes top of mind frequently are some of your more important criteria. And one of the most important criteria for me as I start to think about this executive that I just recently hired had to do with the values that that individual had. On some level, it's a reasonable assumption that when you begin to hire executive talent, there's a presumed level of competence, technical competence. They typically didn't get to where they got to without some base level of competence. It's a consideration that we try to parse out, becomes a little bit more intensive consideration when we move more into the clinical technical fields in terms of trying to ascertain what degree of competence an individual has. But at the senior executive level, it's not the first thing that comes to my mind. It is the values that this individual brings. And that becomes particularly important for me, and I think probably for many people in this room and leading other organizations. We are in an incredible period of volatility, great uncertainty, whether it's within our country or within the businesses that we operate. And in those periods of uncertainty, ultimately what continues to drive toward, supports your drive toward doing the right thing are the values that you bring. And so I try to ascertain those values out of the gates. Not only the values that they bring in their professional world, but how are those values formed in their personal life, their life story. I'm very interested in their life story, and if it doesn't come forward in an interview process, there isn't a second interview. We are who we are sitting here today largely because of our life stories. So values become important for me. Warren alluded to culture. We are, as leaders, in some ways, we're carrying a culture forward to our successors. And me personally, I look at individuals coming into our organization and trying to ascertain how will they fit into what I believe our culture is, and how will they ultimately, in some ways, affect that culture at a leadership level. Most people who participate in an interview with me, the interviews last about 3 hours or longer. And it's a conversation about them, and I'm always trying to sense, well, how will they carry on this conversation with 2,000 other people in this organization? So that's a really important consideration for me. Peripheral vision, which we talk a lot about. Some people maybe refer to it as being able to see over the horizon. In our days, all of us here, sometimes all you see is what's immediately in front of you. Whether you're a student, the next exam, the next class period, or whether you're a CEO, a budget issue, or a regulatory issue, whatever it might be. But the ability to gain some altitude and see just a little bit over the horizon or a little bit further around the corner is really an important attribute. It's what you don't see that will disrupt you, and it's what you don't see that could potentially be the opportunity missed. So I try to ascertain that. What do they see that I don't see? Peripheral vision, being able to see over the horizon. Communication skills are, in my way of thinking, one of the most important criteria for executive success. And so whether they're oral or whether they're written, the ability to communicate to people is so critical. And it's whether it's with your Twitter handle or anything else, at the end of the day, you've got to create a compelling vision or reason for someone to go to a different place. You have to. I don't care whether it's just your senior management team or it's an entire organization. In the case of the North Country, trying to create a vision, the ability to see a different future and causing people to want to go there. Warren spends a large part of his day, I would surmise, communicating about that vision. That is really an important consideration. Experience in life we've talked about, leading change we've talked about, and being able to embrace ambiguity. And we'll probably get to that a little bit later on in our discussions. There's a great reference describing the environment that we're in. It's called VUCA, V-U-C-A. It's volatile, it's uncertain, it's ambiguous, and it's complex. Actually, kind of reversed it. And that's our work. That's our work every day. If you can't embrace that, it's going to be a very, very difficult life as a leader. I don't care what industry you're in.
Sam, when I've interviewed, as Dean Farrar referenced, I've interviewed about 40 senior healthcare executives. And one of the questions I typically ask is, what leadership lesson did you learn the hard way? And very often, I'd say a lot of them come back and say, I hired the wrong person. I was either rushing to hire or some reason I didn't follow my gut and I hired the wrong person. So how do you go about helping managers avoid making that mistake?
I push back and I ask difficult questions. We interviewed probably 5 or 6 months ago. We were interviewing we had 2 final candidates for an executive position. And we go through panel interviews and one-on-one interviews. So we had a group of directors who interviewed these 2 candidates. And in the end, when we were talking about the candidates, they said, well, we liked this about this candidate, we liked that about that candidate, but neither one really fit. What they were trying to do is piece the 2 people together to make a whole person. And I was listening to this, and finally I said, we're hiring the wrong person. We can't make this decision, and we should really start from scratch because, are you looking to mold the person into what you want them to be? Do they really fit the bill? Culture is absolutely imperative. You have people, if you don't fit the culture, you can learn, you can develop, you can acquire the knowledge, but you either fit in the culture or you don't. And a lot of this is asking the difficult questions and saying, am I hiring the right person? I do this for a living, and you don't always get it right. You do, you interview somebody, you have a great conversation, this is the person, and then they show up to work, and 2 months later, you're looking at them like, who were you? Because you're not the person that I interviewed. We're laughing because those of you who have interviewed have actually done that. So it's really looking at the big picture and asking yourself the tough questions and pushing back. And it's not just even the executives. I encourage the recruiters on my team to challenge the managers when they're looking to make a hiring decision that they're on the fence about. Why are you on the fence? What is the hesitancy? Do you need to bring that person back to interview again to hone in on some of the things that you're just not feeling right about? Do you nail it every time? You don't. But when you really push back and ask yourself and challenge each other with the difficult questions, that helps narrow in to hopefully get a hire that is a really good fit for the organization.
Okay. So I'm going to ask Warren one more question, and then we'll open it up to the audience for questions. So my microphone assistants, if you could come up now and see Andy to get the mobile mics. We're going to have two of our students are going to be carrying mobile mics. So if you want to ask a question of the panel after Warren gives his response here, just raise your hand and they'll come to you. That way we can make sure everybody can hear you, and we can also capture your comment on the recording. So, Warren, another wonky question for you. Cisco CEO John Chambers once said that a world-class engineer with 5 peers can outproduce 200 regular engineers. There is probably some truth to that, because the work of engineers, which is designing and coding, can be, you produce it and then you just start replicating it at near zero cost. Is this true in healthcare and in management? And what's your thoughts on an A performer? What is that, and how contextual is that grading?
Wow. Academia. I yelled at him earlier.
Feel free to answer the question or anything else you want to answer.
Anything else I want to answer? Let's think about it. So grading. I try not to grade, right? We all probably mentally grade, but I don't see an advantage to that. As we heard earlier, and when I think about the jobs we all do in healthcare, sorry to say this to the professors in this room and my colleagues, but healthcare is not rocket science. It is complex, but it's not rocket science. And it really boils down to relationships, right? It's how we relate to each other as a team. It's how we relate with our patients. It's how we relate to our communities. So if you can instill within every level of the organization the fact that they're a teammate, the fact of some common relationship skills that they need to have, the fact that, one of my favorite statements is, just pretend it's your mother and you're going to do the right thing. You can build your culture and everybody's going to want to step up. Now, I will agree with Sam that some folks don't want to step up and they want to stay in the position they're in. That's fine, as long as they do it in a way that provides excellent patient experience, right? They can stay there, but they've got to step their game up in that role. But everybody else can step up. So when I think about the earlier concept of how many engineers you need, healthcare is a team sport, right? We need them all, or we're not going to be able to fulfill the tasks. On the nursing unit, you need a certain amount of nurses to be able to accomplish the tasks for the day based on your census. So I don't think it applies. But what does apply is this concept of it's a team sport. We got to make sure everybody knows they're an extremely effective member of the team, whether they're the receptionist or the housekeeper, but they provide an important role to that experience. And if you teach that at every level, everybody rises up. There's going to be some folks who actually choose that this is not the organization they want to be at. We're running too hard. Maybe we're trying to press them in relationship development that they're not comfortable with, and that's okay. I always say to my managers, well, that's okay. They can go visit our competitive hospital. They don't need to be here. You want everybody to be on the bus, right? So I don't believe in that other stuff, okay. But I actually happen to agree with you. But all right, thank you. Not too many people do. I personally don't think it applies in management and healthcare. It's a unique thing. Okay. It was a trick question. It was a trick question. See. All right. So questions from the audience. We've got about 40 minutes left, and I'd like to open it up to you all for questions for our panel. And if not, I've got more. Oh, we've got people in the back. Okay. So we've got one. Anyone else? We'll line them up that way. Okay. And we've got over here, Bridget.
Thank you, Emily. Okay, I'm Jim Lewis from UNH, and question in regard to all the students in the room. Do you have any advice or wisdom or guidance for them who are embarking on a career and probably hope to be the bench strength and then move from that into a more senior role that you've been talking a lot about. So any words of wisdom for all these good people? Thank you.
I'll go first. My words of wisdom would be, get your foot in the door, find a mentor, somebody, not necessarily your boss, but maybe, and constantly network among that institution, but most importantly, continue to volunteer for taking on new assignments at every opportunity so that institution can see your skills. And so they get to know you. Because if you're in a bigger institution, you need to be really visible. If you're in a smaller institution, you still need to be really visible. And the way you get visibility is exposure. Volunteering for things, volunteering for assignments, volunteering for committees. And that's sort of how I grew in this process.
I would agree. It's visibility. In our organization, we offer a lot of internships. And if you have an opportunity to do that, I would absolutely take advantage of it. Some of our internships are paid and some are not. But it's when I have an internship within HR, I have them do a rotation because people will say, well, I want to be in HR. What area would you like to do? I have no idea. So we do a stint in recruiting with the business partners to experience employee relations in HRIS, in our comp department, so they can really see all areas. And, when you go through that process, you can see what areas of HR is of interest, what is not of interest, or, oh my God, I really don't want to get into HR. But it's asking questions. And the other thing is having patience. There's a lot of people that come into an organization and, 6 months down the road and say, well, I want to be the manager. I started as an HR assistant and I worked my way up, for having mentors, for being in the right place at the right time, for being visible and volunteering. But it's also having patience to get to the next level and to experience and really master what you're doing. But take it all in. Just be a sponge and really take advantage of all of the opportunities that an organization will provide for you.
A couple of thoughts, and thanks for posing that question, Professor Lewis, because it's a question that is frequently posed to me by my summer interns that come in from UNH. And I'll say the same thing. And I kind of reflected even on my own career. When I was asked to be CEO, I think I was 28 or 29, and I thought about it for a little while. I said, sure, I can do that, not knowing whether I could or not. And I encourage all the students that come through, all the interns that come through, to not be fearful, not to be fearful of failure at all. You're not going to progress as an individual or as an organization without encountering failures. Just not going to. If you can, it's easy to say and much harder to do, but if you can overcome that fear of failure, the opportunities that are created for you are absolutely amazing. Warren alluded to the fact of volunteering, and I say that to my students all the time, is don't say no. Always offer the opportunity. I can do that. You may not be able to understand fully what it means when you said, I can do that. But I can assure you, you're all smart enough, you'll figure it out. That's really important, to take that personal risk. And then finally, is, as I alluded to earlier, your communication skills. No one will really know how good you are or how capable you are unless you can begin to articulate that. They may see the work, but if the work is not first given to you or the opportunity is not first given to you, how will they know who you are unless you can communicate who you are? And so communication skills, not being fearful of failure, embracing failure, and always be willing to say yes. Always be willing to take on one additional responsibility that makes you uncomfortable because you're not sure you can do it. Those are the things I always advise the interns that come through.
Good morning. Great panel. Thanks. Bridget Stewart from Elliot Health System. So I think you mentioned, Warren, that really this is a team sport, that, in terms of working together, it's a team sport. Could you speak to maybe, and I've heard some discussion and dialogue about leadership and mentoring for physicians. And I think in my role at Elliot, it's really important for me to work with physician leaders. Could you speak to the work that you do around physician leadership and development and some of your experience with regards to that?
First off, how many physicians are in the room? Just curious.
Remember, this is being recorded.
I get that. Our physicians are obviously, you can't have a hospital without physicians. And as we think about the work we need to do, especially the work we need to do in the North Country, in developing some kind of clinically integrated network among 4 medical staffs, among 4 medical leaders, we need to make sure we get them all up to the same kind of standards of what they think their job is as a leader. And that is difficult. Sometimes folks who have an MD degree believe it's the top career degree you can have and you can do anything with it. And that's not always the case. They may not have the right fit. They may not have the right understanding of culture. They may not have the right approach to leadership development and mentoring, because that all needs to happen. So what we do, we build our medical leaders. There's officers, and there's other medical leaders within the institution. Every year we try to take them out of the institution to get them educated about what it's like to be a medical leader. And by the time they rise to the president of the medical staff, they've probably been to 4 of these educational offerings where I go with them, so we learn together, grow together, socialize together, and come back and implement together. And that helps our medical leaders get a better handle on what's going on in the environment, because, you know, in the North Country, it's a pretty closed environment. You need to see the world or hear about the world. So we've been rather successful in that kind of development with our medical leaders. I'd say to you that within the 4 institutions that we have, some of our medical leaders have some formalized education like that, and some believe they know what they're doing. We need to try, and we're going to try to pull this off before Thanksgiving, to try to get them all in the room and have a conversation of where we need to go. But formal education, mentoring, having peers they can go to who do an exceptional job with medical leaders is another approach that we use. But now we need to take it system-wide.
So within our physician world, we have about 1,000 physicians, employed and non-employed, those that have privileges. So we have a mixed bag of physicians. I totally agree with, and I say this all the time with all due respect to physicians, is it doesn't matter what initials you have surrounding your name, you're still an employee and you still need to behave in a certain way. And there are some physicians that aren't a fit for the culture, and there are others that step up and are true leaders and help the organization move forward. So we are actually holding physicians more accountable for interactions. We've just started having physician evaluations, which is new for them, which provides them feedback and opportunity to step out of their comfort zone, be more visible beyond committees, and so forth. So we don't provide formal, but we're moving towards that direction. As you can tell from a lot of the things I said, a lot of what we do is informal, so we're evolving to a more formal process with some of our development in all levels within the organization. But it's also holding physicians accountable and providing them with coaching, mentoring, and opportunities to hone in on some of their leadership skills.
Kevin, you spoke to one specific person you were mentoring to be an executive, but what about physicians in general?
We, if you think about it, it is a team sport, as Warren alluded to, and the increasing pressures that are being placed on health systems really require not only formal leadership in terms of actual individuals holding leadership positions, but also the clinical leaders, the informal leaders, the team leaders, individuals who are responsible for orchestrating resources across multiple settings of care, whether it's in the hospital, whether it's in the outpatient setting or in the home care setting. We are knee-deep right now with the new executive that I had brought on, who happens to be a physician, in going through a process of identifying emerging leaders within our medical community. Who are they? What are their aspirations? Where might they be able to fit in to advance our mission? And trying to profile what additional skills they want to and need to acquire. And so we are in the middle of that right now, and it will be interesting to see what emerges from that. I was just at a committee meeting just a couple of months ago, And a large part of the committee discussion revolved around generational differences in leadership, and generational differences in the way clinicians view care being provided in the healthcare setting. And one of the physicians that was invited to come, a relatively young woman, was so and she was a hospitalist, was so articulate about generational views and how she views, and she was, as I said, young, she's probably about 34, 33, and how she views her interaction with her more senior colleagues and the differences and how those manifest themselves at the bedside and in patient interactions. She was so articulate, and in her discussions, I detected something. So I followed up with her. It was maybe about 2 weeks later. I said, let's go get a cup of coffee, Ginger. And she goes, why? I just want to have a conversation with you, that's all. And turns out she has deep leadership aspirations. And so from there, she has been tasked to work within our credentialing function in our organization. She wants to begin graduate school. She's expected to deliver a baby, I think, this week or next week. Once that's done, she's going to start graduate school and ultimately wants to assume a leadership position that melds classic executive leadership with clinical leadership. So those gems, those diamonds in the rough, they're everywhere. How do you identify them as a leader? It could be just a casual encounter at a single committee meeting, or even in a social setting. It's amazing what people want to do when they're given the opportunity to find their voice.
We have another question. We have a question up here. And if you're thinking about a question, raise your hand so we can get the mic pre-positioned.
Hi, Steve Annan, the Hospital Association. Kevin, I was really intrigued by your comment in terms of sort of looking up over the horizon, thinking out of what's in front of you. And I think in healthcare today, in lots of different fields, that's probably one of our biggest challenges, given the pace of change and the pace of activity. There's so much focus on what's right in front of us. I think former Secretary of State Henry Kissinger called it, the urgent driving out the important. How do you facilitate that in your organizations, within your leadership, as you try and help build bench strength? How do you build that up in your organization so that people understand they have not only an obligation to do the things that are right in front of them, but also to look ahead, to look over the horizon, as you said? Sure. I'm uniquely, benefited or maybe cursed, depending on your view, is I thrive in ambiguity and uncertainty, unpredictability. It is the environment that enlivens me and really gets me jazzed about what I do. And so the uncertainty that looms in all our futures is something that I spend a lot of time thinking about individually as well as on behalf of the organization. I see that as opportunities. There's no question about it. The uncertainties create absolute threats to the legacy systems that we have all managed. And in fact, a fair part of our healthcare delivery system is going to be in a material way disrupted, requiring new skill sets, which is part of what we're talking about here this morning. That I don't find fearful. But part of the challenge that I have is to try to find what are the new tools to deal with that disruption and those new opportunities, to deal with what's coming over the horizon. What I frequently find myself challenged with is an organization that parts of it may not embrace that uncertainty. We talk about not being fearful of failure. I can't tell you how many failures I've had in my career, many. But I continue to always look at that future of uncertainty as continuing opportunity, maybe to fail again, but certainly to succeed. But I recognize, and I think maybe there might even be a few of my colleagues here this morning, I'm not sure, that part of my challenge is to continue to propel leadership to embrace that uncertainty, to embrace that opportunity, but also recognize the failure opportunities that exist out there. And it is hard to drive an organization into ambiguity. It is really, really hard. We have a lot of discussions with my senior management group in terms of the approach avoidance. Everyone is enamored with, pick a technology, telehealth. What a great thing. how that will change the way healthcare is consumed by time and by place. But what does that mean for me? What does that mean in terms of what I manage and what I do day to day? Will that take away what I do day to day? Will a whole part of my business go away and be disrupted? Quite possibly. So what I find challenging in my role is to acknowledge people's desire to stay put in some cases. The comfort and the familiarity in a world that is really pretty crazy right now. No question about it. It is comforting with what you know and with what you're familiar with. But as a leader, I have a responsibility to pull them into the unknown. And the organization, I have that absolute responsibility. And that is one of my biggest challenges as a leader, day to day. How do I do that? How do I do it without losing an organization or people that are relying on me, that want to follow me? How do I not leave them behind? In some cases you may. So that is one of my challenges about seeing over the horizon. It is the joy of my job, thinking about what potentially might be over the horizon. It is the challenge of my job to get an organization closer to that horizon.
When you talk about the horizon, you need to paint the picture. You need to tell the story of where you think the institution's going and why it needs to be there. And you need to tell it over and over and over again. Because you've got to build a burning platform for why people need to do something different tomorrow than they did today. So it goes back to the communication and the relationship building. So if you tell the story over and over again, and actually they see that the system is positioned in the right way, they will follow once they understand what the burning platform is. But you've got to convince them, A, things are changing, B, this is where we need to head and why, and C, we need to be all in this together. And then you can have success.
I think telling people the why in anything that you do is really important, especially in time of change. And you need your senior leadership team to embrace it and be the champions, because if they're questioning it and have concerns about it, everyone else is going to see that and they're going to question it. So it's really over communicating, and that's what I talk to our senior leadership team about. And if you've read the newspaper, we are in a lot of change within the Elliot, and so it's keeping us united and keeping us communicating, and making sure that we're being transparent and being visible and answering employee questions and leadership questions to make sure that everybody understands the why behind what we're doing or not doing. I think that the communication is critical.
We have another question over here.
Yes, I'm Carrie Nolte. I'm a faculty member in the nursing department here at UNH. And I hope that my question serves as a good follow-up with the specific charge of health systems addressing more population health, community involvement, which I think in most systems is a shift from kind of acute care focus. I'm curious about the talent that you're recruiting, and whether that within your systems is something you see as a separate talent to engage the community and focus on population health, or if it's something all of your practitioners should be well versed in and involved with.
That's a great question to contemplate, because we are currently deepening our focus on population health, as it's kind of popularly referred to. And I think there are probably maybe some nurses in the room and some other clinicians in the room who probably in the essential elements of their training understood what population health truly meant in many, many ways. And as we know, and it's frequently been studied, the vast majority of health status and the outcomes associated with your health have nothing to do with what we do in healthcare per se, the social determinants of health. And certainly some of the students here who have gone through UNH, if you're seniors here, you understand that premise. What is it, maybe 20% of health status is actually affected by what health systems do. And I always marvel at that, given the trillions of dollars that we spend, and one might question that the trillions of dollars we spend have no impact on health status. So when I think about population health and the accountability that health systems are increasingly taking responsibility for. Some of that is driven just by, I think in some cases, the changes in the social compact that has existed between states and their population, the federal government and the population, and just a changing of thinking about what health means. And we are in that process of rethinking that as well as an organization in terms of how do we ultimately view ourselves differently and in our relationship to that other 80% that affects health status. We're not going to affect necessarily, the DNA of any one individual that's going to, in a fairly significant way, predict their disease status. We're not going to affect that. But we will certainly have the ability to work in the community in which that disease status occurs. And how does that ultimately impact the way we create pathways into that community to care for those individuals? The types of people we are hiring in that way increasingly have a lot to do with data analytics. We frequently talk about big data and the ability to understand the trajectory of health in any one population, any one community, or any one disease category. And we are data rich. We are not necessarily intellectually rich concerning that data. So we are hiring, or will be hiring, data analysts that look at health, the claims associated with health consumption, and look at various public health indicators for our population. We are increasingly focused on clinicians who case manage, whose role is to transcend just acute care, the acute care setting, but who can move seamlessly between the acute care setting, a med-surg bed, to a physician's office, primary care or specialty care, to accompany someone on a home care visit within our home care organization, or who has great adroitness with the Apple Watch and the personal health monitoring that occurs. Because what I believe, and what I think our organization is increasingly believing, is, as I stated earlier, the consumption of healthcare is being shifted from the legacy systems. It's no longer going to be time dependent or space dependent. It's no longer going to be dependent on if you have a physician's office that is open from 9 to 5 in the afternoon. Health happens. Disease happens regardless of that. So think about the skill sets that are going to be required for that. And what will they look like? Who are the people that we're going to hire? Those are the questions that we're asking, but we're beginning to see the early manifestation of that when we look at the people we're bringing into our organization right now, with different sets of eyes that are capable of looking inward and looking outward, and looking at the patient's experience as one that really has to be seamless across the entire continuum of care. I clearly see that when I meet with my HR staff and see the types of people we're hiring, or I have conversations with leaders in other parts of our organization in terms of what they're wishing they could hire in terms of skill sets. It's very different.
My answer is yes. So it'll have to be the internal people as well as some external people, as Kevin has explained, but all of our clinicians, whether they're nurses or physicians who are taking care of the patients, have got to focus on population health as well. But where we sit, it's not just our institutions that need to help with population health. So I think about the North Country. I think about we have 4 hospitals, we have FQHCs, we have nursing homes, we have home health agencies. We've got to get them all working together to improve population health. And as Kevin says, we can only affect 20% of it, but we're responsible for 100% of it. And, just this last week, we started rolling out our strategic initiative, and one of them is to get our population in the North Country out of the basement. All due respect, they are the sickest folks in this state. So our premise is, how do we get them in 10 to 15 years out of the basement? That will be the proof that our system truly is working. And that will be the evidence that it was the right thing to do to pull the system together. But it's going to be a combination of the folks we have and the folks we need to bring in under this big tent to accomplish that.
Sam, any thoughts from an HR perspective on hiring for this new function?
It's difficult because it's evolving. It's trying to figure out, you have your population of employees that you have now, and trying to get them to move into the mindset, and all of the new candidates and people out there with the new skill set. And it's really trying to put all of the pieces together. It's a moving target, and we haven't quite nailed it.
I think I saw another. Okay, we've got one here and then one in the back.
Yes, hello, I'm Liz Mary. I'm on the Board of Trustees for LRG Healthcare. And 2/3 of my question was answered by the excellent question before. So I'll pose this a little differently. In terms of succession and leadership development, how do you get the voice of the patient there? How do you make sure that the leaders that are currently in your organizations are tied into the community, the aspirations of their patients, how they see what their needs are for healthcare in the future? How do you tie that into some of the learnings and criteria you use for leadership?
So at Elliot, we have a PFAC committee, which is a patient and family committee. And it's an advisory group that get together on a monthly basis to give us feedback of what patients are looking for, their experience within the hospital, what they hear, what the community hears. We also do a lot of community surveys, and we have patient surveys through Prescaney that we get. And it's a great opportunity to look at what we're doing well and where we have areas of opportunity. And it's hearing directly from the patients. We also have a patient advocate, and they meet with patients. Lots of times it's to give feedback of areas that they didn't have a good experience, or that they have suggestions to do something differently based on their own experience or that of a family member. So we're involved a lot with the community and our patients, and we take their feedback to heart, and we use that as part of our strategic planning going forward.
I was thinking about that question. I don't know if I have a good answer for that in terms of direct patient input into succession planning. I think about that, but maybe in a little bit of a different way as I've kind of thought about it. In some ways, maybe it's about the patient, but perhaps more importantly, it's about the community, of which there is a subset of patients that they come from there. And as I think about succession planning, whether it's my own successor or any other parts of our organization, and I think about our mission, I think about the healthcare needs that exist in our community. We're required as an organization to periodically assess those needs by federal law. And we've just completed our community needs assessment in 2016. And as I was going through that and trying to understand how much of that forms a blueprint for our future year strategies and tactics. And I just started thinking about it and reflecting on your question, and you could really transpose that to say, well, how much does that serve as the blueprint for our successors? Because these are long-standing needs in the community. They're not year to year, certainly not in this state. They're long-standing needs. And in many ways, the voice of the community in that health needs assessment, there were many thousands of people that were surveyed in that, forms the blueprint of ultimately all our successors. How do we carry that forward? And that's the best answer I could give you right now. It's a great question.
We do both of those activities in the North Country. The other thing we have been doing at Littleton, and I'm not actually sure if it's going on at the other three institutions, is our clinical managers are required to sort of do patient rounding as part of their day. So whether it's in the nursing unit, the rehab unit, physician practices, they are required to go out there and listen to our patients, to hear how their experience is, hear how our institution can serve them better. And while we get some great information from the traditional, we get some real-time information from that activity, so we can improve that day on things they bring to our attention. So that has been a very successful way for us. And quite frankly, patients love to be asked questions. And it's just a great way to find out how we've served them and what we can do better.
Okay. So we have another question in the back.
Yeah, Peter Gosling. We heard at the beginning of the session a couple stories about, I think from Kevin and Warren, about developing people within their organization. And Kevin talked about spending years developing a physician leader, and Warren as well, developing future CEOs. And it may seem somewhat counterintuitive, but you spend all those years, make that investment, and then you leave your organization. You both clearly see that as a success. And I just wonder if you would comment on the impact. Clearly, there's a positive impact on the person that's impacted, that's going somewhere else and getting a promotion, if you will. But what's the positive impact on your organization and also you as a leader and the image you have as a leader within your organization having done that?
So the last part of the question I'll answer first. What is the image? So the image is we as leaders spend time developing our bench and developing people who can take our position. That sends a really strong message to that culture of that institution that we are there to help everybody grow. So I think the image is unbelievable, and it only enhances the culture that you're trying to develop. With regard to the downside of them leaving the institution, the way I look at it is the last 7 to 12 years that they've been there growing, they've helped develop our culture. They've helped develop managers underneath them. They've helped our organization move forward in the way we need it to. So it's a win, and then it's a personal win when I say they graduated and have gotten a CEO position. So I look at it as a win all the way around, even though they're leaving the institution.
Would probably echo those comments as well. Maybe it's more of a personal level of satisfaction that someone who I work closely with is in another part of the country, West Coast, and will maybe have an impact there. It's a loss for our organization in some ways, yet the opposite side of that view of a loss is it hopefully will be a gain, because the experiences that I had mentoring and working with this individual, promoting him into an executive position, having him leave because of family circumstances, created the opportunity then for me to look at hiring his replacement, which I just did. From the external search, an individual coming from a different organization, but the experiences that I had and the insights that I gained in working with the individual that left, I think created a framework for the person that I hired. So hopefully those experiences will be a gain with the person I hired. He's still with me 2 months later, so I guess we're making progress.
The last thing I would say, if you think about a mentor-mentee relationship, there's a time, all due respect, for when that person needs to move on, because they've outgrown that mentoring relationship and they need to be on their own. They need to blossom outside of the organization. And tied to that is, I always look for folks when I'm thinking about hiring in our organization who have had multiple hospital experiences, because every hospital is different, every culture is different. So as you all think about your careers, you will be best served by continuing to move up in the organization, and quite frankly, I hate to say this, out of an organization and continuing to move up, because you will grow tremendously by learning each of those cultures and how they're different, because every hospital you will learn something new at.
I want to interject here. When I came up to Littleton to interview Rob Mock, who was one of the gentlemen that I mentioned, I happened to bump into Warren in his office when I was going to talk with Rob, and he said something to the effect of, Rob's great. I'm hoping to get him out of my organization. And I sat there, it was something to that effect, though. And I'm like, oh shoot, is this a bad thing that I'm coming to talk to this guy? So obviously not, but,
it's time for kids out of the house. It's time for, folks to grow. And the only way they can grow, quite frankly, is to go to another institution, because they've learned what they could at your institution.
Sam, let me spin this slightly differently. When is it good for an organization to let an A player go?
When they're ready. And I think it goes to what you just said is, kids leave the house and an A player needs to leave the organization. And Tate, I'm going to pick on you for a minute if you don't mind. Tate is a perfect example. He started his career within the Elliot, and he advanced within the Elliot, and now he left and is a COO at another hospital. And we're excited for Tate. He's flourishing. And if he were to stay within Elliot, you look at, going back to what I said earlier, is even though you have individuals in your organization that might not want to grow within the organization, but want to thrive in the position that they're in, at some point, if you have someone who is really thriving and wants to move up and learn more and advance in their career, and you've stifled them that's a bad experience and they're going to leave anyway. But you want to be, it's a win-win to help develop them and grow and then sort of set them free to the next adventure and the next move in their career. And I think that, Tate, you're a success to that story. So sorry to put you on the spot, but.
We've got about 3 minutes left. I want to end on one last question to each of the panel. So maybe a 1 minute answer from each of you. And so I'm going to start with Sam. This is my last wonky question.
I knew it was going to be a wonky question.
In the book, How Google Works, Google execs Schmidt and Rosenberg say in the hiring process, Google leaders look for Googliness. And how they define this as, we want to get a feel for what makes a candidate unique. We also want to make sure that this is the place they'll thrive. So we look for signs around their comfort with ambiguity, bias to action, and collaborative nature. So to Sam, if Google has Googliness, defined as I just said, what is Elliotness, and how does that translate into the organization creating a culture of high performance? And your answer must include the word Googliness in it.
Okay.
For each of you.
So you just want us to say Googliness.
I just really want them all to say that, yeah.
So there you go, Googliness. So I think, if you look at our mission statement, it's inspire wellness, heal our patients, and serve with compassion in every interaction. And it is all about the patient experience, whether you're a clinical person, a non-clinical person. It's really, having the patient come in the door, meeting with the receptionist and every single person that they have an interaction with in their experience within the hospital, whether you're a family member visiting somebody or an actual patient. And that is our Elliotness, is the true patient experience. And ultimately, that's why you work in our institution.
Kevin?
I don't know if I can say Googliness.
You just
yeah, I did. My wife happened to go by the time. I'm taking up the minute. I feel like it's a debate. My wife was going by the table and she happened to see your question set that I had highlighted in yellow, and she's like, "What the heck does that mean, Googliness?" So what it means for Exeter is maybe to kind of rephrase the question. When I interview someone, they ask me, "What is it like to work at Exeter?" I get that question a lot from physicians. And it's not quite the 30-second elevator speech. And probably two things that came to mind when I was thinking about Mark's question is the intimacy that exists in healthcare. And I think that is particularly unique within our organization. There is a degree of codependency between ourselves and our patients and ourselves and colleagues. There's a degree of intimacy that is palpable. It's really quite striking. That's the first thing. And then the second thing is the intellectual rigor. Our organization doesn't suffer people that are not performing at their highest level well. We just don't. And that's probably true of a lot of healthcare organizations and healthcare professionals. We aspire to be the best. We're overachievers in just about every walk of life. And so intimacy and, this notion of being your very best, those are two things that I would probably describe as our Googliness.
Warren, Googliness.
I'm not playing along. My answer goes back to what Kevin said earlier. When we think about people coming into our institution, we need to see if they're going to fit. Are they going to fit the culture? Are their personalities going to fit the folks they're going to be working with? So to me, it's a gut check and it's a fit check for the organization, because we are striving for what they've talked about. The North Country way, as I need to say it now, but it really is all about fit, because I'm sure they're going to bring the skill levels to the table, but will this be the right place for them? Because we want them there for the long term.
So thank you, and I'll try again maybe later to get him to
Good
say
luck.
that. Yeah, okay. So we've got to close. So we are at time. I hope you agree with me that I found three very unusual and interesting individuals to share their experiences with us today. So if you wouldn't mind joining with a round of applause. We're going to now take a half-hour break and resume at 10:30. So I have a task for the executives in the audience, and that is there are a large number of students in here. And I would like to task you to teach them a little bit about networking. I've told them not to clump together, and when I walked in this morning, they were all clumped together. So if you would help them learn a little bit about how it is to do some professional networking, we would deeply appreciate that. Thank you again.
Nice meeting you.
Thank you.
You've been listening to the Health Leader Forge, a joint production of the College of Health and Human Services at the University of New Hampshire and the Northern New England Association of Healthcare Executives. Please go to our website, healthleaderforge.org, for more information or to leave comments about today's podcast. Look for Health Leader Forge podcasts on iTunes, Stitcher, SoundCloud, and other podcast distribution sites. Thanks for being a part of the Health Leader Forge community, and we'll talk with you again in about 2 weeks.